In the previous video, we saw the sequence of events in hemostasis. Now let's look at who actually does what and also how hemostasis is controlled. Mainly, we look at platelets, some clotting factors, and the role of endothelium. I'm Nabeel. This is Pathocyte. Let's start with platelets. When there is a vascular injury, the subendothelial collagen and von Willebrand factor are exposed. Platelets attach to collagen with the help of von Willebrand factor, which acts as a bridge. The receptor on platelet which attaches to von Willebrand factor is glycoprotein 1b or GP1b. Congenital defects of either the bridging molecules like von Willebrand factor or the receptor like GP1b can lead to bleeding disorders. Defect of GP1b leads to a disease called Bernard-Soulier syndrome. And defect of von Willebrand factor leads to von Willebrand disease. Platelets become activated once they adhere to von Willebrand factor. And once activated, they change their shape into spiky spheres and release certain chemicals which attract other platelets to this site. And these multiple platelets are linked together with the help of fibrinogen. And these fibrinogens are held together onto the platelets with the help of receptors on the platelets called glycoprotein 2b3a or GP2b3a, and the defect of this glycoprotein leads to Glanzmann thrombasthenia. Till now we saw Bernard-Soulier syndrome, von Willebrand disease and Glanzmann thrombasthenia. Also, we saw how the platelet functions after a vascular injury. Now let's look at the coagulation cascade. It starts when tissue factor is exposed after a vascular injury. The extrinsic and intrinsic pathways are lab concepts. Within the body, it's almost always tissue factor which starts the coagulation cascade. So through a series of steps, the coagulation cascade finally ends in the formation of fibrin. This fibrin helps in forming a mesh around the platelet plug and forms a stable clot. Among the coagulation factors, thrombin is one of the most interesting one. Of course, it converts fibrinogen to fibrin and helps in the formation of a stable clot. Thrombin also activates many other coagulation factors like factor 13. It's also involved in the activation of platelets and later aggregation of platelet. Again, thrombin is also involved in activation of inflammatory cells like neutrophils, lymphocytes and monocytes. It also directly activates the endothelial cell. Because of all of these things, it is thought that thrombin is involved in angiogenesis and later on in tissue repair also. Remarkably, despite all the procoagulant activities, when thrombin meets normal endothelium, it converts from a procoagulant substance to an anticoagulant. Now let's look at endothelium, the master regulator. The balance between procoagulant and anticoagulant activities of the endothelium determines whether a clot is formed, whether it dissolves or propagates. Normal endothelium inhibits clot formation, while activated or injured endothelium promotes clot formation. Normal endothelium produces nitric oxide, prostaglandin I2, etc., which inhibits platelet aggregation. Also, when thrombin reaches normal endothelium, it gets attached to antithrombin and gets inactivated. Also, this complex inactivates other coagulation factors. Thrombin can also bind to thrombomodulin present on the normal endothelium, which can activate protein C and later on inactivate coagulation factors. Through all of these, normal endothelium inhibits thrombosis, but injured or activated endothelium downregulates all of these anticoagulant activities of normal endothelium. Along with that, it upregulates all the procoagulants, like it increases tissue factor, it inhibits fibrinolysis, and increases all the coagulation factors. This switch decides thrombosis. Today we looked at the role of platelet receptors and bridging molecules in bleeding disorders. Then we looked at the role of thrombin in clot formation and also in prevention of clot. Then we looked at the master regulator, the switch, endothelium. Please check the description below for notes and also post-class test. In the next video, we'll look at thrombosis and related diseases. Think at the cell level.